This is the PA Startup Podcast, episode number 1. This is the PA Startup Podcast, where we help pre-PA students, current PA students, and new grads start their careers as physician assistants. I'm your host, Chris Darst. We are glad you're here. Hey guys, welcome to the first official episode of the PA Startup Podcast. I really appreciate you being here. I hope you're having a great day. I'm excited to talk today. We are talking about the 5 reasons you should be excited to be a physician assistant. Now, if you're thinking of applying to PA school, this is going to be a great episode for you because this will give you 5 reasons to get jacked up, to get pumped, to get excited, all that good stuff. If you're in school, I remember what it's like. It's hard to stay motivated. So this episode will do the same thing for you, help you push through and finish strong and just be glad about where you're at. So if you're thinking about trying to decide between different areas, I hope this clears some things up for you. As always, check out the show notes at pastartup.co/episode 1. And I would love for you to leave a comment and subscribe to the podcast so you get new episodes delivered to your device. That would be awesome. So it helps other people find us and helps keep our conversation going. So, all right, let's get into it. These are not in any particular order. I think all 5 are great reasons. And here, I got to find my notes here. Okay, so number 1 is going to be autonomy. So autonomy is kind of a buzzword, but why does it matter? Here's the deal. If you've gone to 4 years of college and then 2.5, 3 years of PA school, the last thing you want is someone looking over your shoulder all the time, making sure that you're checking the boxes and you're doing everything right. You want some independence, right? You've earned it. You've worked really hard. You've studied hard, and you don't need a micromanager. And the PA profession really brings with it a lot of autonomy. And that is across the board. Whether you're in family practice, you're going to have your own list of patients for the day, where you're seeing people 8 to 5 or whatever your hours are, just like the physician is seeing patients 8 to 5. That's the purpose of being a PA, is to divide and conquer. So if the physician can see 20 patients a day, now the practice can see 40 patients between the two of you. If each of you take 20 patients, you've just doubled the productivity. So that autonomy is great because you are trained to practice independently, and you can make decisions. And what does that mean? That means that you're seeing patients, you're diagnosing conditions, you're ordering and interpreting the diagnostic tests, you're prescribing medication, you're telling the patients when to follow up with you. I mean, from start to finish, you're it. And that is awesome. That is why we go to school. That's what we do. Now, this also applies to people who are in like a surgical specialty like myself. I work in cardiothoracic surgery, which is a very dependent type specialty because they're not going to let me perform the heart surgery from start to finish on my own. However, I do perform segments of the procedure on my own. I am responsible for endoscopic vessel harvesting. I'm responsible for chest closure, wound closure. So in the operating room, I'm still independent because I'm doing my own thing at different times, but at other times it's a team where me and the surgeon, we're heads down, we got 4 eyes on the target, we got 4 hands in there working, we're a team. And a good assistant in the operating room can make or break a case. It makes surgeons much happier when you are an excellent and independently thinking practitioner. Now, outside of the operating room, you can have a lot of autonomy. I do, even though my specialty is pretty dependent, I'm still making ICU rounds on my own. I'm seeing all the progressive care patients. I'm seeing new consults. I'm discussing surgery, the risks, the benefits, the alternatives, the post-op course, the lifting restrictions. A lot of times in my field, I'm dealing with family members who are super stressed out because mom or dad is having this great big open heart surgery. And I'm the guy that they talk to first because the surgeon's busy in other cases or something. And so I'm the guy that they ask, what are the chances that they're going to die? Or, what's life going to be like afterwards? Or what do we need to look out for? And those are all those are heavy questions. Those are big things that we have to deal with. So if I misspeak, like that carries with it quite a bit of weight. So I take it very seriously. I really like the independence of my job, but that autonomy is huge, and that kind of permeates any kind of specialty that you have. Now, keep in mind, as a new graduate, you're not going to have as much autonomy as someone that's got experience, where as you grow in your medical judgment, you'll get more and more autonomy, ideally. So that's number one. Autonomy is huge. Now, that's not a vote for PA over, say, an NP or an MD, but it is a very big feature of the job that we need to remember. So that's number one. Number two is the type of training you receive as a PA. There's two theories of medical education for healthcare providers. You have the nursing model and you have the medical model. Okay, now I don't want to be misleading. Let me read something to you. I looked up the difference between the nursing model and the medical model because I feel a little bit like I'm harping on the nursing model or saying that it's not as good. It's different. It's not bad. It's just different. So I looked up on the nursejournal.org. I looked up the difference between nursing model and medical model. And it says this is a complex and nuanced distinction that makes more sense when you start to study nursing or medicine at an advanced level. But in simplest terms, it's explained like this. Okay, this is a quote. I'm totally plagiarizing. It's at nursejournal.org/nurse-practitioner/NP versus physician assistant. It says the nursing model looks more holistically at patients and their outcomes, giving attention to a patient's mental and emotional needs as much as their physical problems. The medical model places greater emphasis on disease pathology and approaching patient care by looking primarily at the anatomy and physiological systems that comprise the human body. Okay, so there you go. That's an official read. That's not just my opinion, but that is what is out there. So, okay, that's it for the disclaimer. The medical model follows medical school. And the reason I like this and that I feel that it's a benefit is the medical model immerses you in the information, where you are in class 8 to 5 for the first 2 years of your didactic portion. And then for med school, you go on and you spend 2 years rotating through pretty much every specialty, whereas in PA school, you go through the core topics that are encountered in family practice. So you've got family practice, you've got cardiology, OBGYN, pediatrics, orthopedics. So whether you're in the classroom or you're out on your rotations, you are immersed. You're rolling your sleeves up, you're digging into the books, and you are learning. So I worked a little bit in PA just the didactic portion of PA school, which is not great. It was a couple evenings a week. It took away from my studies a little bit, but you really can't work full time while you're going to school because you're so immersed in it. But the good news is that it gives you a very, very, very wide overview of lots of different areas of medicine. And that's important for the next point coming up, but it gives you a very wide exposure to lots of different kinds of medicine. It helps you understand how parts are connected and interconnected and how disease processes affect each other. It just gives you a very well-rounded education. Now, part of the medical model, too, is how PAs recertify, which is we have to do continuing medical education every 2 years. We have to submit 50 hours of Category 1, which is like conferences or journals or seminars or lectures. And then we have to do 50 hours of Category 2, which can be precepting or journal reading and things like that. But we have to take the exam every 10 years. So it's not like you graduate and then you're off to the races forever. We have to recertify every 10 years. And it's not... For me, it's not cardiothoracic boards, it's all of them. So I got to go back to pediatrics. I got to go back to OBGYN. I've got to go back to family practice. I've got to do all those things over again. And what that does, it stinks, I'll admit, like it's stressful, but what it does is it keeps me current on everything so that I can be a well-rounded provider even though I'm in a specialty. If you're in family practice, it only helps because you're learning new stuff, new drugs, new treatments, new guidelines, all that. So now that brings us to number 3, which number 3 is flexibility. So up till now, we've had autonomy, which would apply to PAs, NPs, and MDs. The second one, you've got the medical model of training, the type of training that we receive, and that's going to be limited to PAs and MDs. But now here we go. Flexibility, this is key because this is solely a PA trait. Now, this is really what kind of puts me over the edge as far as I could be kind of on the fence with a lot of these things, but with flexibility, here we go. So as a PA, because I've had that wide overview of medicine and I can handle family practice, which is pediatrics up all the way up to geriatrics, and it deals with some surgical things, it deals with all-encompassing features of medicine. If I wanted to leave my job and take a different job, it wouldn't require any additional training. It wouldn't require any certification or test or anything like that. I literally would apply for the job, interview for the job, and hopefully be offered the job. So that means I could go from cardiothoracic surgery to ER to pediatrics to dermatology. And it's perfectly reasonable because people just understand that PAs are globally trained. So you have a little information about everything. So then if you want to dial down on gastroenterology, guess what? You've got the basis for it and they'll teach you the rest on the job. I have a very close friend who all through growing up, she knew that she wanted to be a doctor. From the time she was 6, that was it. She was going to be a doctor. No questions asked. So she went to 4 years of college, 4 years of medical school, 5 years of residency, and then 3 years of fellowship. That's a lot of school. I'm not real good at math, so you do the math in your head, but that's a lot of school. She got her first job when she was about 33 years old, and she was about a year into it, and guess what? She hated it. She hated it. She said, this is not at all what I thought it was going to be. And it drove her bananas because if she was going to go back, let's say she wanted to switch to something, any specialty, she went from, let's say, surgery to radiology, you start back over at residency. She doesn't have to repeat med school again, but she has to go back and invest at least 3 years, if not 5, in some sort of residency to start back over. Now, as a PA, I put in my 30, 60, 90 days notice, whatever my contract says, and I move on, and it's great. Now, NPs are a little bit more flexible than doctors because they can switch specialties, but they're certified in an area. They get like a certificate in a certain area. Their course of study is pediatrics or psych or acute care medicine or something like that. So they can move within those areas, but they can't go from peds to psych. And because surgery is not part of their training, there's not a lot of NPs in surgery, although they can take a first assist course and do it. It's possible for sure, but there is not as much flexibility for NPs. So this is where, if you're going to graph these things out, this is where the PA profession just screams to the top, because that flexibility means you can move wherever you want. You can switch jobs even within your same city if you need to or want to. Maybe I'm sick of call and I want to take a shift job in the ER. No problem. It's great. So that is a huge deal. And the fact that we recertify every 10 years in general family practice knowledge, that means I'm geared up and ready. I'm current with a lot of things so that I can go do that. So that is awesome. All right. So number 4, we've got the position in healthcare. If you were to go back 20 years ago and you would ask people, what does a PA do? Not a lot of people could give you a definite answer. And a lot of patients, even 10 years ago, when I started practicing, just over 10 years ago, people would say, oh, you're a PA, huh? Oh, well, when are you going to go ahead and finish the road? You know, you're going to go all the way and be a doctor, or are you just going to keep being an assistant? And it was kind of offensive because I was like, that's my career. Like, I picked that on purpose. So that kind of bothered me. But nowadays, it is not like that at all, where people will say, who's your family doctor? And they say, oh, the PA Allison down at the clinic, and really very few people have a problem with it. It used to be the older generation that kind of grew up where the doctor was the expert and you did what the doctor said and things like that. Whereas now we've kind of morphed into the lines are a little bit blurred. And so there's lots of NPs, there's lots of PAs, there's lots of doctors. So people are just used to medical professionals or medical providers. So the position in healthcare is great because we are cheaper than a doctor, for sure. There's getting to be more and more of us, and so it's a lot cheaper for a practice to hire a PA or two to fill a place, to fill a position, and increase productivity in a practice, regardless of the type, than it is to hire a doctor. Now, when you have a surgeon, you need a surgeon to perform the procedures, but if you've got one surgeon that can keep up with the cases, you can hire a PA that can handle, all of the ancillary stuff, all the rounds, all the clinic, all the consults, everything like that, a lot cheaper than adding another surgeon. So I looked up some statistics here. Physician growth by 2023, and this is according to, U.S. News and World Report. Physicians will grow, the profession will grow by 17%. The NP profession will grow by 36%, and the PA profession will grow by 37%. So NP and PA are pretty even here, but clearly it's beneficial to be in one of these two professions as time goes on, because the opportunities for us are going to continue to grow over time, which is exceptional. Basically, the bottom line here is that people understand us. They understand what our role is. They understand what we're doing. So the fifth reason that you should be excited to become a PA is related to finances. Now, a caveat here, do not pick a profession based solely on money, okay? But this can factor in because the amount of time you spend in school is relatively short, and the average pay when you're done is relatively high. So there are a lot of grad schools that you can go to for 2 or 3 years after college, and you can come out and you can make $60 or $70 or maybe even $80,000. But the average salary for a PA right now in 2018 is $101,000. It's actually $101,480 a year. Now, coming out of school, you won't be that high, but that is the average salary. So that's only 2 to 3 years after college. You're in a profession that's going to build up to that. That's pretty great because the amount of debt that you accrued to get there is fairly low in comparison. So it's a great balance. I know doctors that they've got $250,000 in student loans. And yeah, they make a lot of money, but a lot of that money that they're making is going to pay off those student loans. So in my case, or in the PA's case, even if you have spent a lot of money on your education, my private PA school at the time I went was $82,000. Now it's over $100,000. So even if I have $100,000 in debt, I could get it paid off by spending $10,000 a year. And if I'm making 101, I would still have $91,000 to live on. That's incredible. That is wonderful. So again, I wouldn't encourage you to consider financial. I would encourage you to not look at just pay for the job. And that's why I put this last, was so that it was the last thing we talk about. Because all these other things in front of it are, I say, more important. But the debt to income ratio is great. Now, PAs and NPs are very similar. So I believe NPs are probably around the $100,000 range as well. The only thing that throws off kind of the mid-level provider position, which is NPs, PAs, and CRNAs, is the CRNAs, the certified nurse anesthetists. They blow the curve out of the water. I don't know why, but they make $165,000 according to the same report that I read. Now, they are putting people to sleep. They're paralyzing them and putting them to sleep and keeping them teetering on the edge of death. So I suppose that's worth a little something. So they throw off the curve just a little bit. But if you're looking at PA versus NP versus doctor, I would strongly encourage you to pay attention to the income to debt ratio that the PA profession offers you. So there you have it, guys. That is the 5 reasons you should be jacked up and excited to become a PA. So let's review real quick. The first one is autonomy. You don't have someone looking over your shoulder. You're working independently. You are seeing patients from start to finish. A lot of other areas, and I'm not bashing on any of these, but a lot of other ancillary health services, allied health, like physical therapy or pharmacy or something, you're dealing with somebody at one portion of their treatment, whereas as a PA, I really get to help from start to finish, and I really like that. So the autonomy, not having somebody look over your shoulder. Number 2 was the training type, which is the medical model, the immersive, dive in, just get swallowed up by the books for a good solid 2.5, 3 years. That really gives you a great overview of everything that you're dealing with, which leads to number 3 was the flexibility that allows you to move between jobs. The fact that we recertify every 10 years allows us to have the flexibility of switching between specialties without having to get additional training. Number 4 was the position within healthcare, that it's constantly growing and changing. Our profession is understood. People know what they're getting when they get a PA. They understand where we fit in kind of the hierarchy of everything. And then number 5 was the financial, the income to debt ratio, the money you spend to get your training versus the money you're paid when you're done. It's very, very reasonable. Now, keep in mind, some of the ability to pay off your loans depends on where you work. And it might not be dollar for dollar. Like, you might take a job that only pays $65,000, but it's in an underserved area, and you qualify for government forgiveness of your loans. If it's a medically underserved area, there's a couple different programs, and you know what, we should look into that, and we can do a whole episode on that, because that's a great way to figure out how to pay for school. But those are other ways to look at it. So it's not necessarily the dollar amount that you're making versus the dollar amount of your debt. You might be able to trade things up, whether it's tuition reimbursement or days off, or maybe your work week is only 4 days. There's a lot of different things you can do once you get done and out of school. All right, gang, we have reached the end of episode number 1. I thank you so much for hanging with me. I hope this was helpful to you. Please, please, please don't hesitate to reach out to me. We love questions here at PA Startup, so send me an email, questions@pastartup.co. And then if you could head over to iTunes and, number 1, subscribe to the podcast so that every new episode is delivered right to your device once it's released. And then leave us a rating and review. That helps more people find us. It helps the conversation keep going. And, I firmly believe we can learn from each other. So the more interaction we have, the more people you tell about the show, the better off it is for all of us. So if you send me a question and I feature it in a question and answer episode, or you leave a rating and review, and I will read a selected review as they come in on the podcast. If I read either one of those, I will send you a PA Startup sticker that will go on your laptop, or I don't know, wherever you like to put stickers. I'll give you a PA Startup sticker to show your PA Startup pride, and just as a thank you for taking the time to shoot me an email or leave us a rating and review. So hope everything's going great. Next episode is going to be a great conversation. We are going to talk to a surgeon who is very focused on performance and just taking people from good to great. So we're going to discuss what makes a PA go from good to great. So hope you'll look for us then. I can't wait to talk to you. And again, shoot us an email. I'd love to hear what your thoughts are and what you're struggling with right now. But hang in there, take care, keep working hard, and I look forward to talking to you soon.